On behalf of Royal School of Nursing, I, Ms. Lipika Hajurika, take proud privilege to welcome you all in today's webinar, which is being organized on the topic Strategies to Raise the Nursing Standards Beyond Books. In the beginning, I would like to welcome our esteemed panelists and all the participants in this session. The Assam Royal Global University is the fifth private university of Assam, located on NH 37, opposite to Balaji Tirupati Temple. It stands high with its virtue of excellence and a humble contribution to the society at large. Royal Global University stands to be recognized for its world-class infrastructure, cultural events, campus recruitment programs and activities, expert students, and updated facilities. Royal Global University is a leading educational hub in the northeastern region that maintain a particular commitment to run exceptional undergraduate, postgraduate, and PhD programs under 27 different schools. Professional standards describe the competent level of care in each phase of the nursing process. It guarantees that we are accountable for our own clinical decisions and actions and for maintaining competence during our career. This standard encourages us to persistently enhance our knowledge base through experience, continuing education, and the latest guidelines. It provides a guide to the knowledge, skill, attitude, and judgment that are needed to practice safely. Before proceeding, I would like to welcome our Honorable Vice Chancellor, Sir, Professor Dr. S.P. Singh. Sir has been associated with the Royal Group from its inception in 2009 as the director of the institution. Sir has also served as the founder Vice Chancellor of Amity University, Chhattisgarh for almost 2 years before joining the Assam Royal Global University in 2016. With the vision and hard work of Professor S.P. Singh, Sir, the university has been ranked as #1 private university of Assam by Education World within a span of just 3 years. A geologist, MBA, and a law graduate with PhD in strategic management, Professor S.P. Singh, Sir, is also an ardent baseball player and has been actively involved in various social and cultural activities since his university days. With more than 3 decades of rich experience in teaching, research, academic administration in institutions of repute across the nation, Royal Group is blessed twice to have the association of Professor Singh, Sir, in the journey so far. I welcome you, Sir, and also request you to address the participants, Sir.
Okay, thank you. Thank you so much, Lipika, and good afternoon to everyone present here, especially to 2 of the panelists today. Dr. Professor Biswas, she's a principal of one of the leading institutions in the country, and also to Kijum for your presence here from Arunachal Pradesh. So we have West Bengal, Assam, and Arunachal Pradesh together. Our very important person out here, Gitumani Kavar, Dr. Gitumani Kavar, who is the Dean of the School of Nursing, and all the faculty members and students of Dean of School of Nursing from Royal Global University and maybe from all other institutions in West Bengal or Arunachal Pradesh, because I'm very sure some of your students, some of your faculty members will also have joined today's webinar. And definitely the topic is very, very pertinent and very relevant for the occasion. But before that, I was just going through the biodata of Professor Biswas, the way she has started her journey way back in 1983 after completing her, nursing course and then establishing some new institution in Malda, and then also further going to government institution in 2007. So I will give this whole thing to Lipika. She will definitely introduce you. But I was mesmerized by the way the growth you have taken in last 13, 14 years, starting from a government assistant professor to professor and the principal now. So it's a great journey, and I'm very sure this could have happened only because of your zeal, enthusiasm, energy, attitude, personality, and a lot of kind heart, positivity. So all these things required for the growth of individual. So as a nurse is one part, as a professor, as a head administrator, we all know very well that the growth of the institution is not only proportional to the knowledge or the degrees you carry, but also depends upon the type of and kind of human being you are. So I'm very sure that Dr. Biswas must be a very nice human being who could establish many institutions and is running one institution, which is the one of the best institutions in the country. Also, I'm very, very fortunate that we have with us Madam Kijum Sora, and she's also having a long, long, eating plate so far. 23 years is a good time. All right, it is quite younger than all of us, but then it's quite a big time, and I'm very sure that you in Arunachal Pradesh must be bringing laurels for the institution you are working for and also for your family. And I think something very, very important thing has been done by you. But then I think I'll leave it to Lipika, 100 fake nurses or whatever. I'm not going to speak much. Otherwise, what Lipika will do. So I'm very, very fortunate that both of you are here. And I think Lipika has already told you about this new institution. We are almost 11 years old institution, 3 years as a university. And we started our nursing school 2 years back. And we are comparatively doing very well. And now, when this national education policy has come up, where everybody has been asked not to run an institution in isolation, we are very fortunate that our nursing school is working with a school of physiotherapy, a school of pharmacy, a school of microbiology, a school of zoology and biological sciences, a school of biochemistry. All those schools which require as a support school for nursing, they are in the same building. So Gitumani Kavar Madam is very fortunate, I would say that she is having an institution which is having multicultural, multidiscipline, and that all is been complemented by complementing to the knowledge of students of nursing in our institution. And we are blending it so well that many things have been taken by other faculty members. And this is the new norm. The National Education Policy has said that gradually all standalone institutions either will be converted into such institution where more courses will be launched, or will remain as an institution that will be either merged with another institution or will have to close down another 10 to 15 years. So I am very fortunate that this is the new norm, and the university setup will start, better courses. And this is my personal belief also, not national education policy, because I was running several institutions prior to my joining Royal. When it was in isolation, only engineering college, only management college, only pharmacy college, I'm telling you frankly, I was not enjoying it, because that vibrancy was not coming from the all ends, and people were having stereotype. And nursing, engineering. Life is not like that. It has to have the traits of all the things. If a nurse doesn't have exposure of sociology, the social or history, or she doesn't have a knowledge of social work, I think she's not going to become the type of nurses qualities which is required in the current time, when we are thinking about strategies to raise the nursing standards, which is the topic for the day. I faintly remember few things. I mean, my younger days, I born in a government hospital in Lucknow and Queen's Mary Hospital. I have seen, but then my two more siblings born in the family. So by that time, I was grown up enough to see what is happening around. And then many of my relatives, when they got admitted into King George's Medical University, earlier it was KGMC, or later on, one of my uncle was admitted in AIMS for almost 4 months, and I was nursing him from outside. There were nurses inside, but I was a main caretaker for him for many, many months. And he was suffering from hepatitis B, and he could not survive end of the day. But it was a tough journey for me. At that time, I came very close to the nurses to see how they are working, what kind of people they are. And at that point of time, I remember the most of the nurses were from South India. And they were all mostly from Kerala, and hardly I used to see one or two other than Keralites. That was in the KGMC also, and that was in the AIMS. I'm talking 30, 35 years back. But now this has profession, and Northeast is doing so very well in nursing profession. And I think they have made very good inroads into the nursing profession. And I remember, I mean, those nurses were used to speak in a dialect, Hindi or English, which were Malayali. Malayali dialect English, Malayali dialect Hindi. I'm not against it, but that was the norm. We used to think nurses will speak only like that. But time has changed. Time has changed. Even people coming from South or Northeast, they all have to be multilingual. They should know, definitely they're working in Hindi. They should know English well as good Hindi is minimum requirement, because your growth will be stunted if you don't know English and Hindi both. And along with that, they need to know one local language also. 3 language formula for nurses. And I will say 1/4 what I've told Gitu Munikawar to launch, that they should be proficient in one foreign language also. And Japanese, especially Korean, Japanese, Chinese, because there's a huge demand of nurses in Japan, in New Zealand, in Korea. And if my student will be having Japanese knowledge along with them, I think they can make us proud one day by going to other institutions and other country to serve. So that is one part about the languages. But other than that, if I talk about the standards, you set up the standards with respect to how you will rate nurse A to nurse Z, that you all will decide. But I think standards should not only be set up based upon the experience, based upon the technical knowledge and things they have. It should be more concerned and should have the pointers, in my opinion. This is for the topic, pointers with respect to their care, their attitude, how caring they are. I think 50% should go to the skilling and 50% should go to the caring, their communication skills, their empathy, how to check empathy. If nurse is very, very proficient, very good, but she is not empathy, she doesn't have empathy, I don't think so she deserves to be in this profession at all. She has to have empathy. Then attention for details, how good you are, new knowledge, every day new drugs are coming, every day something new protocols are coming, how good you are in. And there should be like pilot training, every 3 years they have been tested that they should remain as a pilot or not. In armed forces, they have been tested that they should be there in the infantry or not. In teaching profession, we have to be there to see that our API is good, with researchers we are doing is good or not. Same way, there should be a test of nurses also after 3 years, after 5 years, to see that they are learning new things or not. If they're not learning new things, they should not be promoted, in my opinion, because you are not concerned about the details. Fourth is problem solving skills. Every day they are facing problem. Ye khatam ho gaya, this is not there. So they should be very good decision makers and problem solvers. Also very important. Now this COVID time, they are covered with the kit. The whole kit is, and then having masks, and they're having so many gadgets, and then they're sweating inside but serving the people. So how much stamina they have? If nurse is having very weak, if she has not been able to carry herself for 4 hours, 5 hours, how can she work for 8 hours, working here and running here and there? So stamina check is also very important. The nurse who loses stamina should not be the senior person. The nurse with the highest stamina should be the senior person. So stamina and their facial expression. If she is having a smiling face or not? If she is always been seen, my God, I mean, nobody would like to go to that nurse to speak about his problem or her problem. It means she don't deserve to be a nurse at all. I mean, that is my feeling about the qualities or standards of the nurses. I mean, along with their teaching skills and humor. Humor is also very important, and commitment for the job and these things. And I think I tell you very frankly, nurses are not less than doctors. And I tell you what I have come to know about nursing profession, 80% of the life saved out of 100, 80% life saved are because of the post-surgery, post-natal, post-care by nurses. Only 20% credit goes to doctors. So this 80% is your responsibility. How can we keep this responsibility to somebody who is not having these qualities? I have seen my mother has gone through a bypass operation in Apollo. I think doctor has operated him, and I think visits maybe once in a day or maybe once in 2 days. Or junior doctors comes every day, but the nurse was there 24 hours. You understand? So who was supporting, who was motivating my mother, who was giving her, pumping devices, who was taking care of her? Only nurses. So I would say doctor has done a job by cutting and putting the things together, but nurse has been main person for the recovery of the patient. So therefore, it is a very noble profession, not less than doctors, but then the standard should be fixed up. And for me, positivity, communication, smile, energy, dedication are the factors. If somebody doesn't have, even Gitumani Kamar, she should not be my student. The student should be checked by their energy. Otherwise, we will not be able to produce good nurses end of the day. So my initial thoughts are like that. I have taken maybe 1 or 2 extra minutes, but I was speaking from my heart. I just wanted to share my thoughts with all of you. I'm very, very fortunate that I will be attending this webinar for some time. Over to you, Lipika. Thank you so much for patient listening. Thank you.
Thank you so much, sir, for your valuable and also for sharing your experiences from your childhood, and also for sharing the ideas like how to maintain the standard of nursing profession. And most importantly, sir, you have motivated us as well as for the budding nurses who has come up. So thank you so much, sir. Moving on, I would like to request Professor Dr. Gitumani Kaur, Dean, Royal School of Nursing and Medical and Allied Sciences, to deliver an introductory note and bless the session. Over to you, ma'am.
You have to request her again. Probably she was having some connectivity issue. So request her
Yes,
again.
sir. Ma'am? Ma'am, am I audible to you, ma'am? Okay, as ma'am is having some problem, so we would like to go ahead and later on we can hear from her. So now I would like to bring few points related to the webinar. Like participants are having any queries related to the session can put their question in the chat box, which will be handled at the later of the session. And for the panelists, I would like to request ma'am that as we have 1.5 hour time for this webinar, so kindly please take 20 to 30 minutes for your presentation, ma'am. The request. Moving ahead, we have among us Madam Professor Bishnupriya Biswas. Madam has graduated as well as done her post-graduation from Government College of Nursing, SSKM Hospital, Kolkata. Madam has also worked as sister in charge at MJN Hospital, Kuch Bihar, and then as a sister tutor at School of Nursing, Eastern Railway Hospital, Malda. In 1991, ma'am worked as a public health nursing officer in Regional Teachers Training Institute at Singur, Hooghly. And apart from it, madam has established a new school at Malda and also has run 2 batches successfully, later which ma'am got an opportunity for a higher post in state government. Madam has established a new College of Nursing at Bankura, Samilani Medical College, which is also now full functional. Currently, Madam is working as a principal of West Bengal Government College of Nursing, SSKM Hospital, Kolkata. Madam has published several articles in different national and international journals. So it is my privilege to welcome you, Madam, and we look forward to hear from you, ma'am. Kindly take over, ma'am.
Ma'am, you're not audible.
Madam, kindly unmute. Madam, we were not able to hear you. I think.
No, she has to take out her this device because the device is not working. Disconnected from the computer. Yeah, you're audible now.
Yes, ma'am. Yes, ma'am. You're audible now.
Okay. To and this Royal Global College at University, and thanks for inviting me to speak on the very burning issues of nursing profession today. And I want to highlight that before 10 years, only very little opportunity for the nurses to go and so on. And the picture is the northern region in West Bengal. But despite growing of the institutions over 10 years, I have been tempted to say that in 2001 to 2003, I had undergone a medicine course. As a part of this, I had to visit the RK College of Nursing, where I have seen very little girl, very young, tender girl, they are pursuing MSc. And now the picture has come to this. and Northeast pursuing the higher education. The nurses are not very high quality with energy, with lots of education and all those things. But two pertinent question I wanted to ask you. Two questions. Do nurses believe that enormous opportunity in nursing education give rise to high quality patient care? Number two, do able to gain trust of the population? I think in both the cases, the answer is no. So what to do? We have to make out a solution as soon as possible. Otherwise, we'll be declared as a dying cadre. Means our services is no longer required in the hospital. So in the hospital, last year I went to visit hospital with my student to supervise the MSc nursing student. I have seen the students of MSc nursing, they are not allowed to do this endotracheal suctioning and that. So on asking, they have told that it is their responsibility nowadays. They have been given this opportunity to do this. So is procedure in the this our critical care. So why nurses are there for? Only to provide the personal care that can be done by not at least there's a high education degree, diploma, PhD is not required to do this. So nurses has to advance know so that yeah, they work with enthusiasm, internal motivation, then run for the higher and teaching job. So we have to gain trust of the population. This is the prime time when we should go for this gaining the trust of the population, and that should be start now onwards. So I have sorted out some of the points where we can speak on. So let me speak one by one, that is prioritize patient and people. So how to give priority to the there in the hospital and for whom? The answer is the nurses for the patients only. So at least the nurses are there in the hospital. Everyone can see the nurses at least for 24/7 hours in the hospital. Maybe that are not available, but nurses are available. It means that there are enormous opportunity, enormous time for the nurses in the trust. Nurses are paid there. So that can be done only by need-based care. If we provide the need-based care, the trust can be regained. And one thing is a very frequently said words, that is nurses, and what Sarah also highlighted, that with positive attitude, with knowledge, and with a skilled hand. That means we have to work with hand, heart, and brain. So now question, how many of us possess this quality? At least skilled hand, no. Then a very positive attitude, no. Or brain knowledge, no. Then what the nurses are doing? So we have to go for this. We have to try to gain all these things. So do the nurses, and one more thing I have to highlight, that do the nurses, right, the blend of humanistic approach with a skilled hand. So skilled hand along with this humanistic approach is now very important for the nurses to regain the trust of the population. Then second point I want to highlight, that is emphasize interaction. So nurses are not speaking much in the hospitals or in the community. The students are taking the books in the hospital, they are reading the books, but no one is speaking to the patient. But little bit of information if the patient can get, and they will feel really their suffering is lowered to half. But in the community health nursing field, I was working in the community health nursing field and in the nursing institutions where these courses are taught, and there with this long, I do say that ANMs are better trusted healthcare provider in the community than the nurses in the hospital. People may not rely on us in the hospital, but in the community, rely on ANM. ANMs they have a regular interaction, and there is a in this healthcare provider and the people or patient. So my next point is respecting the human right. It is not very neat to the nurses. Respecting human rights, human rights are respected, and we have to take care of these people. The nursing age, and we have to provide unbiased and this is the beginning of our career. Right? And of us, we are thinking, yeah, right. So protection of patient dignity. We should that we are doing much for the patient. Actually, we are doing for us, for our profession. Here, if we show dignity to our, ultimately it will uphold the values and ethics of our profession. American Nurses Association Code of Ethics for Nurses with Interpretative State in 2015 expressed their dignity, unique attributes, and human rights of all individuals is a fundamental principle of nursing profession. And in the Health and Human Rights Journal is issued, highlighted on severe violation of human patient patient rights throughout the globe. And this is going on, this violation of right. Because of this violation of right and abuse, one phrase has come, that is the human rights and patient care. So this phrase used as a framework for monitoring, documenting and analyzing abuses in government and other parties accountable for this. Then the professionalism. Now, what is professionalism? That is profession. And to listen, that is but you know, nursing just qualifies as a profession because it has got a huge body of knowledge, independent decision making. So nurses are nursing is a profession. So professionalism are form and speaking politely. It is it compares critically yeah. Helps that
Excuse me, madam. Excuse me, madam. Ma'am, actually, we cannot hear you properly. Madam, yes, ma'am. Actually, we are not able to hear you properly. If you if you turn off your video, I think your audio will be more clear, ma'am.
Okay. So okay. Now I have just turned it.
Yes,
Now it's
ma'am. Now
okay.
we can hear you, ma'am. Yes, ma'am. Yes.
Okay. So positive attitude, compassionate patient interaction, teamwork, integrity, which is the professional responsibility of each nurse. So we have to emphasize on positive attitude, compassionate patient interaction, teamwork, integrity in the work. This is the responsibility of each nurse. And Sarah has told so many times, with a smiling face, a positive attitude, compassionate to patient, that are the most thing what we should know. And keep yourself, and always we have got, see, we may have our personal values and beliefs, but if we keep ourselves refrain from allowing a negative reflection of my personal beliefs and values on the patient. So while patient care, I have to forget my personal beliefs and values. Maybe I believe in something, some religion, some all those things, but thing is that while patient care, we have to just forget about everything and we have to go for this. Now, my next point I want to highlight, that is pride for profession. In the lockdown period, I was going to some nursing institution with one of my students. So I have seen she has written in a very big and bold font, nurse, in front of her car. So any one of us, and all of us, I am asking this, whether I am comfortable for a bold declaration that I am a nurse. If we don't respect ourselves, so how can I expect that community and the society will respect us? Nurses can, what Sarah has told, nurses can save the patient's life, he has told. And so not only that, in 80% cases, the nurses are there to save the life for the patient, and he has given the credibility to doctors only 20%. So let me just reverse it. If I save at least 20% of patients' lives, why we are less than anyone? So feel proud of our profession, and that will eventually realize our due respect from the people and society. Our view on profession, that means our professional proud, will bring a positive change in the entire profession. Now next.
Madam?
And education is nowadays a burning issue, and we have to think on this. And the profession, this unlikely to the medical profession, more we are educated, we are far away from the patient. Nurses feel, I think the most of our people, we feel physically and psychologically very comfortable and secure in the classroom setting than the clinical area. Here is the imperfection of nursing profession. So you have to overcome it. And I think a bottom-up approach in education, the nursing education, I mean to say, nursing education should start from the bedside, not from the safe classroom environment. So what to do? We know most of the topics can be covered in the bedside of the patient. And this life situation in teaching will bring a qualitative change in the nursing education. This approach will shape students' understanding in a different level. They will assimilate the essence of patient-centered education. They will be internally motivated to fill the gap between practice and education. Then publicity and share ideas, views with the people. See, publicity, propaganda, this may have a little bit of negative sense, but still advertisement is required, and publicity somewhere is required to share our ideas, views, share about the nursing and nursing profession. So a little bit of publicity, I think it is required. And you know, nurses are very poor in documentation, so and unable to establish their contribution to the healthcare setting. So dissemination of information in media, pulling media people within the nurses for spreading the information on nursing and issues and challenges of the nursing profession. I think the prime time has come when we have to, the younger nurses, I am giving the responsibility to the younger nurses to think on this. Then now I think it will be probably will laugh at me. I want a political orientation of the nurses. Don't laugh. I think this is really required, because we the nurses keeping ourselves far away from politics. My view is political involvement of nurses is standard of the profession. The political involvement will help in manipulation of resources from the government and the other non-government organization, and a bigger sphere we can extend our hand, and we can raise our voice in appropriate place. I meant to say this assembly or parliament, and easier for the nurses to mobilize and pool the resources. So don't refrain yourself from this your political orientation. It is required. I think it is required. Actually, it is my view. So I'm sharing with you. So you will think on this. Now, patient advocacy is not new in nursing profession. It literally means is to offer independent support to those who feel they are not being heard, and to ensure that they can speak and their rights are respected. So in India, you know, almost 80% population is not literate, and they don't raise their voices. So here is the nurse's job to assist the people to access and understand the appropriate information and services. If I go to the hospital, now many a time I see the patients, they are from remote villages, they are just roaming here and there. The boards are there, they can't read it. They are asking, whenever they are seeing any people with a apron, they are asking, and someone they are giving answer, someone not. So it is really this illiteracy and awareness among the common people are the actual hindrance. So we have to go for this, we have to advocate. And we can pursue the legislators for those people who can't raise their voices, who does not have access to healthcare, who can't demand their dues. So next is involvement of the professional organization. It is another important issue. I think professional organization can play a vital role to raise the nursing standard by promoting evidence-based practice, supporting clinical research, organizing in-service education, hands-on training. Conferences will open the eye of the professional. It is not only that, I mean to say that not only that should not be in the classroom, that is in the clinical area where there is opportunity for the hands-on training. Professional organization can pursue the nurses' involvement in policy and decision making. Effective organization can support the nurses' interest. Disseminating the professional knowledge is another issue which the professional organization can promote. So professional organization, if they involve, I think our rights can be served. So organization is the right position to do advocacy for the entire nursing fraternity and nursing profession. Professional organization ideas, prosperity corps, and energetic participation of its members, assisting in increasing the credibility and gain public trust, protecting the consumerism. This consumerism is a term, it has recently been emerged. So we have to think about the consumerism. It is in the government hospital, it is maybe free of cost they are getting, but everywhere it is not possible. So raising the visibility of profession and attracting talented workforce is another area where the professional organization can play a vital role. So thank you all, thank you Lipika, thank you Gitumuni, thank you Dr. Singh and Kijum Sora. So I think from early morning, I am at the back of this to get it done, but I was really having trouble, and that is why my mobile also showing low battery. I don't know whether I will be able to continue or I'll continue with some other device. You may not see me, but I'll device. I'll try in the laptop again. I have to join and I'll do that. Okay, thank you, Lipika. Thank you once again, and thank you all the audiences.
Thank you, madam, for enlightening us with your valuable words and also giving us time. We love to hear from you that how every step is very important to maintain the nursing standard. There is so much things that you have said, like we need to have that attitude, good communication skill, then professionalism, how it is important, and beside that, we always should have been connected with patients. It's in the clinical side, so it's a very important, ma'am. And we are happy and glad that you could attend, you could give us such a nice presentation to us, ma'am. Thank you, ma'am. Moving on, we have another eminent speaker today with us, Madam Kijum Sora. Madam is currently working as Deputy Director Nursing, Directorate of Health Services of Arunachal Pradesh. Madam have been looking after both charges of Registrar, Arunachal Pradesh Nursing Council since 2013 to 20 and Deputy Director Nursing till date. Under Madam's leadership, Arunachal Pradesh Nursing Council is the first state among Northeastern region to introduce NRTS, that all we nursing people already know what is NRTS. And it's the first state in country to implement licentiate exam in the line to raise nursing standard. And Arunachal Pradesh is also the first state in India to phase out GNM and upgrade to BSc nursing, eliminate more than 100 fake nurses from the state, cleared all unrecognized nursing institute from the state. Thank you so much, ma'am, for gracing us with your presence today. I leave the session open to you, ma'am.
Deepika, can you hear me?
Yes, ma'am, we can hear you.
Okay. Okay. I request the attention from all the audience and BC sir especially, and among charming, beautiful Gitu ma'am, my dearest friend. Thank you for inviting me here as an like guest lecturer. Then actually the main theme was chosen by myself. I feel this is the need of the hour. I think this somewhat it is out of box during this pandemic, the COVID pandemic. But I thought being a nurse is what we are lacking in today's are some my experience. So this is practically all out of the books. That's why beyond books it is. So I invited all my nurses, all the administrators and all faculties to give attention to my points. If you agree with, we can go ahead, and then it may be like somebody may not like my point also, so then we can have a discussion. The first step, I'm taking up this topic to the my nursing profession. So this one. Okay, wait, this one. Video. No. PPT. And VC sir is there or not? Can you hear me, sir? Singh sir is not there, I think. And he has said all many things that I wanted to say. He already covered up. So this is the topic. Huh. Can you hear me all? Is this clear?
Yes, ma'am.
Okay. And this is the standard beyond book. I'm going to speak about the expectation, what publics are having from us nurses, the patients and their families, and our co-workers. I'm being an administrator. I have been to so many places in the meetings and in the conference. I have been interacted with many people, and this is my practical experience. And I, being a nurse, also, this is my practical feeling that we should have this. This is the expectation from the public, patient, and co-workers. So how to meet up the expectation? Then we'll see. The co-workers means doctors or other staff, they expect us nurses to be very calm, quiet, competent in all the procedures, reliable in all aspects, and the most important thing is a team player. You must be a leader, and everywhere in our nursing syllabus it is written the nurse is a leader, nurse is a researcher, everywhere. Now it is a expanded role of the nurses, so it should be a team player. Okay, and now it's a public expectation. We'll look into the public and patient expectation and their families and relative expectations to the nurses. They are, what is this? We must be approachable, as our VCs are already said. We must be very approachable at any moment when the needy person in the distress ask for the help. We will be there ready to help them. Help, empathy. These all are the words we are since from the beginning we do study in our course. And the next is how to meet.
Excuse me,
So
ma'am.
from this is my point of view, no the other points of view.
Hello.
So in this, yes.
Excuse me, Kijum Sora madam. Would you please make slideshow? Could you please make it slideshow so the full screen?
Slideshow is not coming to you.
No,
I know this is coming to you.
Your slideshow is coming, but it is not slideshow. It is good.
Okay, it's coming. Okay, thank you. This we have already talked, and
Yes.
we have covered this. And okay, sorry. Then how to meet those expectations. My one all saying I want to cite before you, and you also might have been very accustomed with this. And one Margaret said to their children, when they learn to make a plus and minus and multiplication, that is enough to earn your livelihood. In my case also, I am thinking knowledge is very good, all the syllabus is very good, but then we must be limited to what we require today. And I have been discussing with my nursing colleagues in the WhatsApp and other groups, and many have suggested me that some syllabus are not at all used in the practical area. So that's why I think the minimizing the syllabus. It should be practical oriented, and then interactive approach of the teaching and the learning should be maintained. And even in the contents of the syllabus, if though there is a syllabus, but then content of the syllabus have to revisit. Some contents are unnecessary elaborate. That also we can minimize this. So psychological, emotional needs and physical needs and spiritual needs are the main nursing required nursing needs now. And then to support this, what we have to do is we must adopt one Japaigo model of OSCE. Till date, I am using it 5 or 6 model of Japaigo OSCE here in Arunachal in the hemoglobin estimation, then newborn baby resuscitation, pathograph, and IUCD insertion, BP measurement. But then many of our important nursing procedures are left behind. So we can all bring out those procedures in a OSCE format, and we can make it in a separate box. Then all procedure must be repeated in the lab number of times till the student can handle it without looking at the lay down status. And it should be repeated again and again so that without even hesitation, they can carry out a procedure. So this is my honest feel. And another my feeling is one day or 1 week ahead. This is my experience being a BSc nursing student and even the MSc nursing student. I have experience. That's why I'm telling it. Being a faculty, we have to do is 1 day or 1 week ahead, we have to list out all the available diagnoses in the ward where students are supposed to post it. And let them accustom with those disease. What is these prognosis, diagnosis, treatment, nursing care require, everything they have to be exposed. Then only they should be sent. And with that, one logbooks. Logbooks, I have one sample here. So logbook should contain all those disease and then all the sign and symptom, and they can correlate it with this logbook and see them. Then only the student will be able to learn it in a practical manner and a true spirit. And most important thing what I have observed being a nursing student also, and till now, the presence of clinical instructor. Instructor, this is not instruction. Instructor is a must. When like in our BAC, I don't know regarding your college, Royal Global Institute, regarding our institute in the BAC Nursing in Guwahati, no tutor, no instructor along with us. Just we are roaming in. What to learn, we don't know. We're just asking the patient what is the problem and why to know done, we don't know. So these kind of things may be happening till there. That's why everything should be in the planned way, very specific way. And then one word I have been listening from my beginning, we should not be given to the spoon feed to the student. But then it is just opposite. My feeling is in nursing, we have very limited time, limited period. So everything should be in the ready-made. Rather, I think, let them handle. Since from the morning 7 to evening 4 hours, hour is clinical, then theory. So we don't have even time to take care of ourselves. So everything should be in a small, short, brief, simple type and a OSCE format, either in the MCQ type. So if we can do this, all we learn in a small span, and then the descriptive type, elaborative type, we can do in a later on to see the language, to the see to that the student can make a language sentence or not. But then in nursing, most thing is I have seen is we need to know it by point and by CQ type. And another most important thing is coordination with hospital staff, teaching staff, and also with the administration at the planning level is very important. There should be coordination meeting monthly or yearly. There is no coordination. Hospital staff is doing their duty in their own way, and then faculties are doing their own way, and administrator planning their own way. There is no coordination at all till today. So coordination is the need of the hour. And some kind of incentive to the hospital staff for teaching students may also enhance the learning environment of a student. Like when we place the student in the hospital, they have no responsibility. They are not paid for this teaching. So they won't see to the student. This is the practical situation now. In a private hospital who have a private institute, they, I think, have a different scenario, but in the government or in other private hospital affiliated to government hospital, students like are no parents. They where they will learn, they are just roaming in. They are used for gauze making, they are used for bed making. No learning, no bedside teaching, nothing. So this should be changed. Then the teacher maybe engages like a Baylor method, Baylor model, TMC Baylor model can be adopted. There one teacher in the professor in the college is the some in charge in the hospital, some specific one. So there is a link, and then they have a responsibility, and they are teaching the student. They have every rights that where is the instrument is kept and everything they are looking up. So students learning is very nice and there no obstruction. But then other setup, you all know Gitu ma'am is very much acquainted with those situation in a RNC and the GMC staff where that's I still remember in the labor room where in the early morning or at night we are not given the case to deliver. In the notebook I have to enter, but I don't have a case. And medical professor, they used to come and they give their case to their student. Where is our teacher? Where is our instructor? They don't give us the case. So we, the nurses, just looking from the far, we cannot learn it until unless you touch it. The sign is saying, if you see it, you learn it, and if you touch it, you know it. And opposite, I have said, sorry. That thing, the nurses are now everywhere, even in the government setup and in the private setup. So this should be changed. And now we'll come back to the how to increase the standard. My standard is not written in the books, not the lay down standards, not accepted by this International Nursing Association or the National Nursing Association, but this is my suggestion, my honest feeling that we can, within ourselves, we can implement it. See, this is proper counseling during admission is need of the hour. One should not be forced to be a nurse when there is no interest. When one is no interest, as sir also, BC sir also said, one has to be interested in it, deal to do for the welfare of the patient, and there should be one like one feeling of the social activist, helping attitude. So in during council, you have to be tell in a elaborate way the how nurses will be, what nurses is, what is her scope, what is her responsibility, role and responsibility. Then only if at all she is interested, then we can go ahead with, and no interested, we cannot force them. Because I have seen many nurses, they are nurses now by compulsion. They don't want to do in the hospital. They want to do bedside care. So this is my honest feeling and my experience. And as sir said this morning in the introductory, said we have to have a smiling face in our face, always. If there is so much of sorrow in our family back behind also, but then when we step into the hospital, we should express our, we have to change behind the home. I have to see for the ailing patient and make, though it is a superficial, make a smiling face. And if you don't want to speak also, just close your mouth and smile and do your, carry out your job. And then the candidates for nurses must be committed. One, I have said, really have a chill to work for ailing patient besides earning livelihood. And one must not join nursing course just to earn, but he or he must to join nurses to serve and serve only. So to do this, how we can do now? The first 1 to 6 months can be dedicated entirely for the rigorous behavior molding, simulation with different situations. There only we can rigorously make them, though they are not ready for the nurses to carry out all the procedures in the bedside, we can mold them like army they are doing. All persons are not born army, but an army after entry into the job, they have been given training and they have molded, and they now become, when we just see the army person by face also, we can make out, yes, he or she is the army person from his behavior, from his work, state, like physics and way of talking. So same thing we can introduce here in the nurses behavior molding. Even from the look and even from your voice, we could be able to make out, yes, she's a nurse. This is my honest feeling. And this period, one must be very much accustomed with the working condition of the nurses in her entire service life. Those who cannot adapt to it may be allowed to leave the course, no issue. So we are not going to then only we are going to get the better nurses. So it is, some saying goes, it is better to have no cake than a half-baked cake. So we are now mostly having a half-baked cake. So I will go back to madam's, my Bishnupriya's madam's one line. More the knowledge, now we are reducing the nursing care. Nursing is less, more the knowledge. So I will go with ma'am. You are really, you have said the one line, it really touched me and I go with you. So that's why I'm saying let's limit the nurses, limit the knowledge, and be like a nurses. So I want to show you a video clip here. Why I am saying all these things. Listen to this video clip.
Excuse me, ma'am. Ma'am, we cannot hear the video clip.
Okay. It is not audible.
No, ma'am, it's not audible.
Okay, then we'll try to do. Kami ta video na. So. Okay, then can you hear it?
No, ma'am.
No.
No, ma'am.
Slide show me. Slide show. Some problem is going on.
Ma'am, if it is okay,
Okay,
can
then
you speak to us, ma'am?
even video also I.
Yes, ma'am.
PPT also is missing now. So yeah, just so. You can see it now.
Yes, ma'am, we can see.
Okay, then this video is actually regarding the negligence. Mother, I'll tell you the short story. Mother came with a labor pain in the early morning 8, and she has and left in the bed. But then 4 hours, she was complaining of so many weaknesses, tiredness, and then dizziness. But then no nurses attended. Then the morning 8 evening, then whole night she was requesting to nurses to call the doctor, but then CD nurses were not responding. So ultimately, later on, baby was born still, and mother also died. Now case is now under Human Rights Commission due to the negligence. Both the nurses and doctors are liable. So here I have written one line: a nurse is one who opens the eyes of the newborn and gently close the eyes of the dying man. It is indeed a high blessing to be the first and the last to witness the beginning and the end of the life. But in this case, we just have done the different. We have not at all followed these lines, and it is very nice. We are saying nurses are the host of the hospital, hospitality of the hospital. Nurses are, but and now these days I feel that we are missing somewhere the hospitality of the hospitals and the host of the hospital. Now we became the guest, and as our Bishnupriya ma'am said, one day or other they were going to be vanished. So we have to think of now new generation. We need to revisit this. Okay, then I just wanted to ask here, what must be the cause of the death of the mother and the baby? Is the when patient report, they were all fine, everything was fine, baby's heartbeat was fine, but then all of a sudden in the night, baby declared death, and the mother also later on at 2 p.m. early morning, mother also dead. So there would have been the electrolyte imbalance because of the long period of non-food, because the mother in the pain, and then pulse and the BP could have been monitored by the nurses on the duty, and they could have listened to the patients complain that she don't have energy to deliver. She was the second gravida, so she have already delivered one child, so she knows her capability. She was already declared that she won't be able to deliver. So here also there is a negligence. So this need to be changed now. But then from our side also, from nurses side, the other contributing factors I'm seeing is the ratio of the nurse patient. Ratio of the nurse patient is not at all fulfilling the national norms and international norms. So this is the one kind disturbing the nursing, quality nursing care. And also the what I see is, may not be practical, but then what I see is the uniform of the nurses. One should dress in the proper uniform, dress tidily, neatly and tidily. So even looking at the nurses, patients have some relief. So this kind of thing also will help in the nursing standards. Because I have seen many nurses just putting on the robe, not even iron, or wrinkles around, even hair also not combed, not tied properly, just putting on the some other shoes, making so much of sound and looking very untidy also. This also makes, so we are like, I also say that we are like a air hostess in a flight. The passenger in the flight, they are very happy for a short period of time while flying, looking at the air hostess. They are very beautifully dressed and beautifully smiling, talking very nicely. So time goes. That same thing we can apply here in the hospital. In a short period of time people came and admitted. That's too with so much of pain and agony. So we need to talk them with very nicely, with so much of sympathy, empathiness, warmness, kindness, smiling, everything. And then last, yeah, I feel that library at workplace to make research material available. I'm jumping it to make it a short. So much of research have done how to make evidence-based practice. All those now all are limited to college, madam, in the college library, not in the hospital, in the clinic. So it has to be, there should be one library in the where nurses are working. So library should be made available. There should be journals. There should be research material available. How can we make the patient better? All those evidence-based research material must be available there. And then, as I say, the proper coordination among administrator, faculty, clinician, researchers is the most. And all the materials of research must not be limited to college and its library, must be made available to clinical area. So in a one line is there, what I feel is in medical legal case, as I have shown video, though you could not see it nicely, this is a medical legal case. So if your behavior is good, it can save thousands of your mistakes. Yes, ma'am? Do you agree? If your behavior is nice, you are very welcoming and you are smiling, you are doing your duty sincerely, even though you don't know exactly what you have done. You might have committed small mistake also, but then your good behavior can whip off all your mistakes. And then your rude behavior, how much knowledgeable you may be, how much equipped with the knowledge, practical based practice you may be, but then your rude behavior will invite thousands problems in your workplace, which is amount to medical legal case. And this line has to be remembered by all of us nurses who are in medical, clinical side as well as in public health sites. So in short, it is say the knowledge is limitless, but behavior of nurses is most important in clinical setup. Now, to achieve this goal, the faculties in the school and college to be a role model. Ma'am, please don't mind you, Gitu ma'am and Bishnupriya ma'am, you all are the renowned faculties, researchers in the school, college now. But what I feel is somewhere back in the college and school, there is some lapses. We need to be you all and we all have to be a role model there, and all the behavior modeling should be done there, not in the clinical side. So the responsible now is lies with all the faculties, madam, you as an administrator, as a principal. And then one, ma'am, you are from the SSKM hospital. I have done my PG from SSKM hospital. That's why I feel like, if you don't mind, I want to cite one example there. How nurses of this one SSKM hospital. One fine morning, we're posted in the cardio ICU. So when it is like a common ICU, madam, you might have seen that common. So many beds are nearby and only separated by the curtains. Nearby patient beds are very close, but only separated by the curtains. So when I enter inside, in the middle, one man was found dead. And then both the side patients are alive, very active, and the middle patient was found dead, and he was not in a proper position, and then naked, one male patient naked. So I feel hesitated, but then what they once I ran, and then nobody was taking care of. Then I went back and just took out the bed sheet, white bed sheet, and covered it up. So we say with dignity dying also we need. When person is dead, so it is our nurses' duty to make them position nicely, and then dress up and then close all the. Even after dying also, man is lying naked and exposing all his private part. It doesn't look nice. So these are the things I feel that we need to reform ourselves. We need to revisit our practice. Beside from all the research and practical evidence-based practice, so small things can make us more perfect. And then one thing, ma'am, I want to say you is, have you ever heard someone saying that because of that nurses procedure, then all the treatment we have been saved? No, till now we have not saved, but then we are refer as the kind. That nurse is very soft, kind, and sympathy, and very smiling, very nice. So if we can imbibe only these things, we can do a lot, and improve our nursing profession, ma'am. So my suggestion is regarding to do this descriptive study may be carried out. You all are a research scholar, ma'am. Then the descriptive study may be carried out on the relationship between nurses' behavior and patients' recovery for further action, and also comparative study among government and private hospitals also may be carried out to see the existing of any difference in it. So as government hospital nurses are blamed more to be rude than private hospital till now. This is what I am listening till that. So these are all the practical experience I have undergone and I have seen and I have heard as an administrator here. So to say out like ma'am and Gitu ma'am and Bishnupriya ma'am, sir has said, I have nothing to introduce, like I have done this, but then I have done a lot, like a mother of this department, this profession in Arunachal. Day and night I'm working, but when I speak out, nothing is there. But then I'm still trying. I'm trying for to make it a more better profession, and then everybody now realizing the nurses are good profession, and now they are coming to it. So thank you very much, Gitu ma'am and Bishnupriya ma'am and Lipika. So sweet of you, and then VC sir. Thank you, and everyone, all the participants.
Thank you, ma'am, for sharing your valuable inputs and for imparting the knowledge on OSCE, like how it is important. It plays a role in evaluating the student nurses, and also highlighting the one's motivation to serve humankind. So without any delay, I would like to request Professor Dr. Gitumani Kaur, Dean, Royal School of Nursing and Medical Allied Sciences, to deliver a closing note. Kindly take over, ma'am.
Thank you, Lipika, and thanks to both the speakers for their beautiful explanation on the topic. I'm very much thankful to both of them as well as our Vice Chancellor, sir. He has given in detail about what nursing professions should be. Okay, going to the topic, strategies to raise nursing standard beyond books. So when we say beyond books, that means person has the skill in their hand, in the heart, and they should be competent and compassionate. So first I'll be speaking on the education, then we'll move on. So the education, as education at the present scenario, we are moving to the blended education. Even GC also said we should be fixing our education. Even the new education policy, what has been very recently approved. On that, it has said that there should be blended education or hybrid. There should be some amount of
Excuse me,
online
madam.
education. Yes.
Sorry for interruption. I would request Hasina Begum, kindly mute your audio because it is creating disturbance. Yes. Good morning, ma'am. Kindly continue, ma'am.
Okay. So this blended education, UGC has said, UGC has given that there should be 20, first they said 20% is approved. Now they have said that 40% of the syllabus can be taught by the online. But being a nursing profession, we can go for the 20% of the online mode at present scenario as
Excuse me, ma'am. You are not audible, ma'am.
sorry. So when we're going to the blended education or the online mode, we can go for as UGC has said, it can be 40%, but from Royal School of Nursing, we are going to the 20% to see if the course go on because it has to be done in online mode. We do not know when it is going to be open. Probably it will be open by October, but still, if it is open, also some of the courses will be taught by the online mode. That means student will be made responsible for their own study. And the online courses, I would like to tell all the nursing people, whoever is attending this session, the online modes, they can go for MOOC or they can go for SOYA, which is already approved by the Ministry of Human Development. So MSRD has already approved, and there is some approved courses. So we can go for those courses, whatever is available online. And we have seen and said already for our next session, we are able to incorporate that 20% of the syllabus on the MOOC and SWAYAM. So those courses were already, there is examinations, they can get credit, they have to get certification out of that, then only they will be completing that course. So the students will be supervised by the teacher how they are doing that, and whether they were able to go on. Registration will be done by the teachers, follow-up also will be done by the teacher. So this is one very important thing I would like to share. And previously we were going on the lecture mode to the students. I would like to say that lecture mode is not, it is only teacher centered. So we should focus on the student centered. So when we say the student centered, means there should be group discussion, there should be concept mapping, there should be role play, there can be case study, there can be debating, there can be problem solving approach. So these are the things what we are going to, why we should be incorporated in our education. And very important thing, we should be going for the high fidelity simulation. As now we have seen, because of COVID, most of the practical sessions we are not able to conduct. So we have to go to the simulation. What are the simulation procedures or modalities available online? We have to go through that. So on this, I would like to share there are very, very good simulation exercise already available. This is given by the Elsevier and it is very nice. So we can go through those modules. And some of the modules it is freely available, but some of the modules we have to buy for the institution. But there is very good videos regarding the clinical procedures. And yes, for our next webinar, as Madam Kijum Sora was telling, Japaigo models were very good. On 14th, we are going with the Japaigo model. On 21st, we are going with the Japaigo model webinar, which I have already talked with the director of Japaigo, who is at Govt West. So Dr. Sudhir joined. Already we have had a discussion on that. We are going to discuss on 21st webinar. And Japaigo has given very good John Hopkins University Education. It is a corporate, it is an agency who is taking care of the health sector of Government of India. So they have developed very good OSCE models. They have very good checklists. So we can use those checklists and OSCE models, which will be very helpful for our students. Especially they are dealing with the reduction of maternal mortality rate, reduction of infection in the labor room. So most of the materials were related to the labor room and related to the gynecological obstetric nursing, but still there is another modules also are available. So that is called skill work attendance module. So those we can utilize in our setting. As I have also undergone that training, we are utilizing in our settings, as well as in the future also we are going to utilize. Then another very important concept is gaming. And when they are doing the learning with the gaming, as they will be doing the like video gaming, so they will be learning what are the clinical decisions they have to take while doing that gaming. Then only they will be able to proceed. So this will be a very, very, very good prospect, which is already there in like foreign body. But in India it is not available. But slowly we also can adopt. These are also available, some of the online platforms. And then I'll go to the practice things. So practice is very important. It is very important. There should be dual role. Until and unless the educators are responsible for the clinical settings, definitely we will not be able to bridge the gap between the education and practice. So to have the students' skill, I should have, or the teacher should have, full responsibility of that practice setting. Once I have full responsibility, that means I have full control over the setting. Then I can command what are the things to be said, or what are the things to be done, or what are the things my students need to practice. Then definitely there will be not another person control that they will controlling my practice, what I am supposed to practice. So this is very important. This is already there in CMC Fellow. So it is from long back, as I have done my master's from CMC Fellow. I have observe it, how much important it is. Once I have come back from CMC Vellore, I have tried to insist it where I was working, but as many people are, it is very bad to say because people used to go away from the responsibilities. So nobody wants to take another or extra responsibilities. Even there was constraint from the hospital sectors also. Anyway, we will not talk about all those things. As I have seen, there are many problems with the government sectors. So we cannot do whatever we want to do. And after my so much of education in CMC Vellore, even I have done my hospital and health management also. I want to do many things for the nursing profession. But with the limited resources and my position also was no, I could not do. So I decided to quit that job. I took voluntary retirement, and you can see I have come to the private. And now, as you were telling, that students should look like air hostess. I used to tell my students always, you all should look like air hostess. You should have same hairstyle. You should apply lipstick. Come with the makeup, and wherever you go, it should be in your identity. They should. I have taken my students for Negrims in one conference. There, even Manju Bacha Madam, who is the ex-principal of AIMS New Delhi, she was telling, these are good students. They are so smart. Then afterwards, she came to know that they are my students. Then she was coming and telling me, your students were so smart. They are not looking like the nursing students. They are looking like MBA students. I am proud. It should be practiced everywhere. So that is I'm trying to practice, making them smart, trying them to build. And our students, we are not leaving them alone. All the time, one teacher is there with the students. So it is very important. Teachers should handhold the students. Then only they will be able to learn. And it is very important. Practice, practice, practice. Then only it will make perfect. So, and now new education policy also telling there will be abolishing. They are going to be abolished Indian Nursing Council, and there are many council, pharmacy council. Those will be abolished gradually. There will be only bar council and medical council also will be revoked, but in place of that there will be medical board. So all this other council will be replaced by one council, which not council, they say HERA. I forgot the full form. So that they will be responsible for accrediting all the institution, and all the institution has to be a part of the university. As our Vice Chancellor Sir was telling, there will not be after few years, there will not be any institution, stand-alone nursing institution. It has to be a part of the university. And as Sir was telling, we are very much thankful. We are learning so much in this university. Not only nursing, we are exposed to all the, like from engineering to everything we are learning. Even we are learning what is going on in mathematics, what is going on in engineering. We are learning what is going on in biotechnology. And even I'm so much happy to learn what is going on in psychology, what is going on in English. So previously we are not doing, I know only nursing. So if we know only nursing, that means our mindset also very limited, very small. So when we are in a broad setup, we are learning much more things. And our students, they are not alone. They know that they are part of all these big universities. They have to compete among all the discipline students. So they have to go at par with to other students. It is very, very important. And we are giving our students one foreign language. Along with that, we are teaching them communicative English from second year, so that afterwards they will be able to go for IELTS as they are having a foreign language, so they will be able to go for the foreign countries easily, as well as they are learning communicative English, they will be able to go from the IELTS exam or TOEFL exam very easily, so that they are open to learn. And moreover, along with that, they are learning behavioral science. Though psychology they are learning, above that we are giving them behavioral sciences, so that they are molded right from the day one. So we are teaching them how to act, how to behave, how should be their attitude, what should be their attitude, and how they should act and how they should smile. As I have said already, how they should dress, what should be their shoe. The shoes should be polished we are making them perfect all the time. Every dress should be very ironed properly. So up to the shoe polishing properly. So everything these are the small things, but it is very important to be a professional. So like the other professionals, we also have to be at par. So their knowledge, we are seeing their knowledge also as they're up to date in the knowledge. So we are giving them our vice chancellor sir, he is giving very much up to date information, and he is sharing whatever the online platform available all the time so that the students can learn. So we are giving them best possible. So they are getting all the sources, and it is a private university. So we are not leaving to the students. You go through. So there will be feedback system. So after they go, we will find out whether they have done or not. So everything there will be accountability. So everyone is make accountable what we are doing, even though we are making the students also making accountable what they are doing. So then definitely everyone has to do what they are supposed to do. And leadership is very, very important. I hope I am able to do the best leadership in my institution. As a short on the standard, I'd like to conclude my speech telling that as is the successful termination of helping relationship of client. So it is successful termination of helping relationship with our client. Then T, to have clear idea or conception about the knowledge. Then T, to have, T I have said A, assertive planning. So we should have planning and it should be executed and it should be assertive. Then N, nature of client and nurse interaction should be very much important. Then D is directing others. We should be able to, as a leader, direct others. Then A, analytical thinking. We should be able to analyze, and then we should go for decision making. Then R, respect status and policies. Respect others, respect all the human beings, respect society, and respect the community. Then at last is a D, data collection. So you go for research and find out what you are doing. It is giving benefit to your client, to the society, to the community, to the universe at large. So I'm coming to the conclusion of my talk as we are coming to the end of the time also. Over to you. Thank you so much. Once again, thanks to everyone.
Thank you so much, ma'am, for sharing your valuable ideas how to raise the nursing profession, both in education and as well as in the practical sector. So as we have come to the end of the session and it is already 3:32, I would like to conclude here. And we can see that there are no queries in the chat box. So lots of participants are giving thanks to the two eminent speakers for imparting their knowledge with us. So I would like to thank our two panelists for devoting their time to us despite of busy schedule. Thank you, madam. I would also like to thank Professor Dr. Gitumani Kaur for your constant guidance in conducting the webinar. I would like to thank our Honorable Vice Chancellor, Sir, Professor Dr. S.P. Singh, Sir, Registrar Madam Angira Mimani, Ma'am, Chairperson Academic, Sir, Professor A.K. Buragahai, Sir, and also Royal Global University members, IT section team, and also for helping us in organizing the webinar